Good afternoon, everybody, and thank you for joining us today for another one of our MAG-free specialist education seminars. And today we have the lovely Dr. Lara Wetton, who is an Australian trained medical practitioner, and she has spent her time working in the aesthetic surgery and aesthetic procedure medical procedures. So those are things that you might commonly know as cosmetic surgery, but in Australia that's not the term we use at this time. And these are the procedures. They're not medically needed, but they're things that make us look better and feel better. Sometimes there's some element of medical necessity, perhaps people who've had a disfigurement or a deformity or a scar or something. But by and large, these are the things we do to make ourselves look and feel better. And they are really important to people's self-esteem and to their psyche. But of course, this is an industry that has a lot of risks and there's a lot of issues around it. It's still something that's not very well understood by many people. So her presentation today brings together her very impressive wealth of experience, advocacy and work in this area to educate you around this so that when you have legal matters, you can feel confident to book Dr. Wetton to do your assessments in these matters and to have better understanding of the cosmetic, surgical and medical industry. So can I ask if you would please stay on mute during her presentation so that noise from your home or workplace doesn't interrupt the flow and the recording. At the end of the session, there'll be time to ask questions, but if you have to go before it's finished and you've got a question, please type it into the chat and I'll make sure that it gets asked. You'll receive the slides and the recording usually within a day or so after the recording is finished. And of course, it will go up onto our YouTube channel with all of our wonderful specialist seminars that you can watch again and again. So without further ado, I'll hand over to you. Thank you so much, Dr. Lara Wetton.
Thank you so much, Michelle. So I'm pleased to talk to you today a little bit about informed consent in cosmetic surgery and medicine. Briefly, just a little bit about me. I'm a fellow of the Australasian College of Cosmetic Surgery and Medicine. I'm also completed the American board exams in cosmetic surgery, and I'm a member of the European College of Aesthetic Medicine and Surgery. I've been in the industry in Australia for about 15 years. I am also on the council in our college, and I review an aesthetic surgical journal. My practice is in Double Bay, and it's about 80% surgery and about 20% non-surgical. So as we know, the cosmetic surgery industry is growing worldwide. Men are becoming more and more interested in these procedures, and they range from, non-invasive things like Botox injections or chemical peels to more invasive procedures like facelifts, breast augmentation, and things like that. Of course, the aim in all of this is to attain a more desirable appearance, and sometimes function is also present. For example, in a big abdominoplasty, patients do benefit functionally from this surgery. Now, quality of the informed consent varies amongst practitioners. It's difficult to standardize this process. Recently, last year, the Medical Board of Australia introduced some minimum standards for all of us to go by. There are many different things we have to apply in our consults, and one is the number of consultations that we need to have with patients prior to them undergoing their surgical procedure, which is at least 2. The cosmetic patient can be quite a different kind of patient to other surgical specialties. The patient could be of any age or gender, and more likely than not, they are psychologically vulnerable. We can say in this modern day that we are all psychologically vulnerable because we're exposed to social media and a lot of high expectations in our society. These patients are often moving through a transition in life. For example, they might be going from one marriage to another, one career to another, and often they desire some sort of an emotional or psychological boost. Emotions are usually pretty high when it comes to cosmetic procedures. The patients might have some anxiety, they might have some excitement, some stress, some fear as to what they're going to look like because we're dealing with appearance. It's really important to keep all of these complex factors in your mind while you're doing the consent process with these patients. And as an operator, we have to be very discerning. We have to constantly ask ourselves the question, does the patient have a good understanding of what we are proposing to do? Are they aware of the risks and complications? And would this procedure be in the best interests of our patient? Now, informed consent is an individual's decision given voluntarily to agree to a healthcare treatment or a procedure. And it is made after the patient has been given accurate information, all the concrete evidence has been explained to them, and they are given some options. The patients should have a full knowledge and understanding of the benefits and material risks to them or someone like them before they have the procedure. As well as this, they must have full capacity to consent. They must give their consent voluntarily, free of coercion, and they must consent to a specific procedure or specific surgical procedure. They also need to have the opportunity to ask any questions that they might have, discuss their concerns, and speak openly to the practitioner. This informed consent should be a process. It's not one event, and it should be a continuum of discussion with your patient. Now, just a little bit about what is capacity. When we assess a patient's capacity, we're really assessing their cognitive function, their capacity to make an informed decision. So patients who have capacity should be over 18 years. They should have a sound mental state. And of course, this could be evaluated by many means, including a psych review, GP referral, some processes in the rooms. For example, now we have a mental health screening test in the rooms prior to undergoing surgery. Patients need to go through that and complete that. And patients need to have the capacity to really understand the advantages and disadvantages when it comes to this surgical procedure. They also need to have a working memory so that when you tell them, they understand and they can then explain to you what you've just told them. Of course, language becomes very important as well. Now, informed consent also applies to a specific procedure. For example, an abdominoplasty with liposuction. So we can't just add whatever we want on after they've given their consent to a specific procedure. Sometimes this can be challenging, but ideally any contingency which may or may not be added should be discussed prior in the consultations prior, so the patient has a good understanding. If this and this happens, I will be getting that, as opposed to waking up and suddenly having something else done. It's really important to inform the patient of small details that you may not think are that important. For example, in an abdominoplasty, you might have drains and how to manage the drains post-operatively and what that will mean for your recovery. Or for example, you might have an indwelling catheter for 3 hours, and what will that mean? It's important to try not to change procedures at the last minute. Often we see this in the pre-op bay. Oh, actually, doctor, I think I want to have this and this as well. This can be quite challenging because the patient often hasn't gone through the informed consent process in terms of the added-on procedure. Now, of course, it's important to know that the patient is giving their consent to a specific doctor. The patient needs to know who will be performing their procedure, and they have given consent to that doctor. So they should also be aware of the training and qualifications of the practitioner who will be performing the procedure, and possibly the training and involvement of other doctors or nurses in the surgical theatre. In the near future, hopefully we will have an endorsement for cosmetic surgery, and then patients will be aware of the endorsement process and where the doctor stands in that process. Of course, it's very important for the patient to be given the point of contact or an emergency number, ideally for that specific doctor who will be performing their procedure. As I said before, consent is a process, and it's not just about handing the patient a consent information brochure and them ticking the boxes and signing. It should be a lengthy process in which the patient reaches an understanding of the intricacies and they decide what they are happy to choose. Now, this is ambiguous because it is very difficult for a patient to understand the intricacies of a cosmetic surgical procedure. Since it takes many years to understand it and be able to perform it, it's a very hard task asking a patient to understand, for example, a revision breast augmentation in a 1-hour consult. So I think education really plays a big part in the informed consent process in cosmetic surgery. Of course, the patient should be making a decision free of coercion or pressure from yourselves as the doctor, or from, family or friends. And it's very important, obviously, that the patient understands exactly what you are saying. And again, this can be ambiguous, so it's important to repeat yourself and be very clear with the patient. The patient needs to understand all the content and feel listened to, and then be in a safe space, in a non-threatening environment in which they feel safe to ask their questions, no matter how silly they think they may be. Now, of course, our role as the clinician is to ensure that the patients receive all the information. This should be both in a written and a verbal form, to educate them as much as you possibly can in terms of the whole gamut of what their process will look like. So that's really our duty of care, is to educate the patient. Now, we also have a responsibility to provide information that is essential in terms of what's real and what may be things they find on the internet, or things their friends sent them from Instagram. It's important that we can combat some of these with some factual information. And of course, we should be available for follow-up questions. So not being able to contact the doctor or ask further questions could be distressing for a patient preoperatively. Keep in mind that some of these procedures are quite expensive. They're not covered by Medicare. And so the patient really needs to be given clear written and verbal information in terms of cost. This can be quite lengthy because it involves the surgical cost, which is obviously the cost for the surgical procedure, but then the patient needs to be aware of there are also anesthetic costs for the anaesthetist. There are hospital costs. The patient may need to stay overnight for 1 to 2 nights, and they would need to pay extra for overnight stay. If they're having breast implants, the patient would need to pay for each implant. They also, of course, need to fill their prescription for antibiotics and painkillers and things like that. There may be other ancillary sort of assistance that the patient may need on their healing journey. For example, manual lymphatic massage regularly after their liposuction. And this can be quite expensive. So it's really important to discuss with the patient all these little things that may add up, and not give them a surprise after they've had the surgery. Suddenly they need post-operative garments, and that's another $100 or whatever. So to be clear and open about this at the outset is very important in terms of the consent process. I briefly talked about timing. So it's important to give the patient adequate time for the consent process. And as we know now, we need to have 2 preoperative consultations prior to booking a surgery. Most of us, I would say, have about 3 to 4 preoperative consultations. There is a lot of information to impart to the patient in one consult, and it can be quite overwhelming. So we often need to revisit some of the things that we discussed again and again. We know that in terms of the guidelines, one of the consults needs to be in person, and the second one can be online. Now, it depends obviously on the procedure and the patient's understanding. Sometimes this is enough. Other times the patient may want to visit you in person and discuss things again in a bit more detail. Of course, you can gauge the patient's understanding by asking them questions and making sure that they've understood everything that you've imparted. And I talked briefly about giving them ample time and space in a calm, quiet environment. Ideally, there shouldn't be too much else going on. Often patients do come and they're on the phone, or they're distracted. And I find this can be very difficult to do an informed consent when the patient is not fully present. It's better to let them sort their other things out and then come back for another time, so you can do things in a calm and clear manner. Then, of course, they can think about things and ask you questions at the time, and then come back with further questions after that. So, of course, we need to make sure that we act in the best interest of our patients always, and that our processes are legal and ethical, and that we're following strict guidelines. So we obviously have tools in the rooms that can help with psychological assessments, mental health, and we can do a check like that. If we're not sure, of course, we can refer on if we feel the patient is not suitable for a particular procedure. And we need to make sure that, yes, of course, we are their guiding practitioner, but we don't have a paternalistic attitude in terms of our informed consent. If the patient says, oh, doctor, I'm not sure what to choose, I think it's better to say, well, how about I give you all the information, and when you're ready to make a decision, you can then come back once you're better informed if you're not sure what to choose, rather than just guiding them or directing them in a particular direction that you think might be best. Now, of course, we need to make sure that the patient is not coerced by other influences. So, at times this is quite important when it comes to breast surgical procedures, because there may be a partner in the background who is really wanting the patient to have a bigger sized implant. And the patient may not necessarily be so keen to have such a big implant. And it's up to us as the treating doctor to figure out where this is coming from, and if the patient is really being pressured by outside influences. It's also really important at this time, comparing this type of surgery with life-saving surgery. So as a surgeon who is performing surgical procedures for life-changing surgery, it's obviously the duty of that surgeon to save a life. Now, as a cosmetic surgical practitioner, we're not obliged or forced to perform a particular procedure on a patient. And it's really important to recognize that if a patient is not suitable for a surgery, no matter how much pressure they put on us, it is far better to let them go away and think about it a bit more. It's important that we are not coerced. And I find that is sometimes can be a little bit challenging, but it's important just to remember that they shouldn't be coerced and neither should we. So I was thinking about how much of the informed consent is also really making sure that the patient is adequately prepared for cosmetic surgery. Most patients don't understand what it takes to be prepared, and it's our job to impart on them what this may mean. Often they get quite surprised because it's a lot more than they had anticipated. Again, we talked about the cost. There are a lot of things to consider, and it's important that they have the full gamut of the spectrum. And then practically, I think in our society, because cosmetic procedures are at the tip of our fingers, we can go to a shopping center and have a few injectables. Patients often don't realize how invasive the surgery can be. So it's important that we discuss the recovery time with them, and we sort of assess whether they have the time, the space, and the help to have a cosmetic surgical procedure. Especially big surgeries like a breast revision surgery, abdominoplasty, even a facelift. Patients may not realize the extent of the practicalities involved, not being able to drive and things like that. It's important to assess whether your patient has a supportive family and friends network who will support them on their recovery journey instead of judging them and criticizing them. Sometimes this can be really deleterious to their healing if they do have people around them who are not supportive. It's very important also to make sure the patient has realistic expectations. Now, this is a big one, and I will touch on it again a little bit later. It's important in our consent process to always stress the complications, sort of describe the worst case scenario to a patient and then give them the more likely outcome. At the end of the day, we're not magicians. We can only work with what we are given. And although we would love to make everyone look gorgeous and like a supermodel, we actually are only given what we're given at the time, and we can do our best with each particular patient. So of course, we talked about not having BDD, and that ties back to my previous talk about patients with body dysmorphic disorder in cosmetic surgery. BDD is not the only thing that we should assess for. So it's very important to figure out where your patient lies in terms of anxiety, depression, or other mental health issues. Because cosmetic surgery can be a traumatic event like any surgical procedure, and a patient who may have a high baseline anxiety, one other stress, for example, being in physical pain or looking very swollen or being very bruised and feeling self-conscious, may actually trigger severe anxiety, social anxiety, and these are really important to consider. Make sure the patient is emotionally prepared. That's a difficult one because these patients are often patients who, as I was discussing previously, may be going through a transition in their life, and they may already be in an emotionally very fragile space. So it's important to gauge, will this patient actually cope with another stressor in their life? Sometimes it's better to say, look, why don't you finalize your divorce, come back in 6 months, and we'll talk again then. Because these are surgeries, it's very important to do a background health check and make sure that the patients are medically fit to have an invasive surgery. There's no chronic pain syndromes that we don't know about. You may think, oh, it'll be okay, it's just a facelift. But if the patient has a chronic pain syndrome, the pain from the facelift may be extraordinarily higher and may be become a real problem for the patient. So we've talked about written and verbal information given to patients, but what should this written information be? Now, we could write a whole textbook and give it to a patient to help, educate them. But there are a few key points that I think are really essential before a patient consents to a procedure. And I think one of them is, what is the procedure? Describe it. Is this procedure known and, has it been being performed for many years, or is this something that you're just trying out for the first time? How is this procedure performed? So this can be a bit challenging for the patients to understand the technical side of things. Like, for example, when I describe for my patients a labiaplasty procedure, often I will draw a little diagram because it can be difficult to understand which part of the skin goes where. It's important to let the patient know where their surgery will be performed and their options. There may be 2 or 3 hospitals that you operate at, and the patient would like to choose. Similarly, there might be some accompanying procedures that are recommended. For example, if you're giving information on abdominoplasty to a patient, you may want to give them some information on liposuction, because often these 2 procedures are performed together. Of course, very important to go through all the risks and benefits in your written document to the patient so that they can easily access it. If they're wanting to show friends or family, they can easily find it, and there's a list there for them to go through. Written information is not the only thing. We also need to give some verbal information. So keep in mind, a good verbal discussion will not substitute your written booklet. You need both, and it needs to be obviously in the language of the patient. It's in the discussion that you can describe things and go through what the risks might be. It's much better if you sort of highlight the negatives before they have surgery, and then they don't get a surprise. It's better to make them stressed beforehand than make them freak out afterwards. When you're talking to them, obviously, it's important to discuss the short-term and the long-term benefits and risks, and then talk about the physical and mental and psychological impact that this might have on the patient for an extended period of time. It might be weeks. Of course, also important to discuss with them their options about not choosing a surgery. So unlike other surgeries, patients who are wanting to have cosmetic surgery, they don't need to have it most times. It's a want-to thing, not a need-to thing. So things that may contribute to a patient's decision, obviously it might be external factors that we talked about, it might be mental health issues, and it might be obviously advertising in the media. So just a little anecdotal thing, as I was saying, we want to talk about what's realistic for a patient. So I might see a patient and I tell the patient, your breasts won't be symmetrical. They're not symmetrical now. They'll never be symmetrical. Your cleavage is wide. We can't narrow it as much as you want. You don't have very much fat, so we can't do a fat graft for your breasts, and you will never be a double D cup. It's just unrealistic. So I might impart that to a patient. And in their mind, that's what they're seeing. No matter what I say, they've got that in their mind. So it's really important sometimes to get them to bring in photos so you can say, you will not look like that. And if it means you don't want to have the procedure, so be it. It's important to burst their bubble prior to the surgery. Some things you can do is show them some photos of complications, which sometimes brings things home to them as well. It's important to note, better not to show them photos of what they may look like after, because they will hold you to that result. So it's much better to show them complications. And as I said before, the patient may be okay not to have the surgery. And if you feel like it's in their best interest to defer the surgery or put it off completely, that is far safer. We're running a little bit short of time, so I'll just make this a little bit briefer. So basically the consent process should, that's right, the burden of informed consent. So according to Avant, about 10 to 13% of all complaints involve a consent issue. And this can, of course, arise to claims. Surgeons have never been involved in malpractice who provide procedure-based protocols. So that was a really interesting study. So cosmetic surgical practitioners who actually gave information like booklets or written sort of complications didn't have any litigation against them. And I thought it just goes to show what we should be aiming for in all our procedures to prevent these litigations from happening. I wanted to run through a couple of quick cases before we finish up. So these are not my patients, but they're patients that I've come across over my career. And so case one is a patient who is 72-year-old. This was, years ago before any APRA regulations, and she wanted a facelift. She had had a head injury a few years before, and she suffered mild cognitive impairment, but the surgeon thought that she seemed fine, the surgical team. And she obviously went through the consent process and everything was fine. She ended up having a facelift, which went very well. She was happy with the outcome, but her family found out that she had a cosmetic surgical procedure, and they said that, she wasn't of sound mind, she shouldn't have consented, and that she had been coerced by the surgeon. And then the family wanted compensation for this, and they were very upset. So this just highlights the fact that it's really important that the patient is in the right state to give consent. Case two was a 33-year-old female, and she wanted a breast reduction. The surgeon organized for that to happen, and she gave her consent for a breast reduction. Now, on the table, the surgeon decided that he'd done the breast reduction, but there was a little bit more fat on a few areas, and he thought it might be nice to do a little bit of fat in the axilla. So often that is something that we will do in a breast lift or a breast reduction, but he hadn't discussed this with the patient. And he did the liposuction, and the patient woke up and was very concerned that she was bruised in the armpit, and that she hadn't consented to liposuction, and why was this done? Our last case was a 38-year-old female, and she was going to have an abdominoplasty. Consent form was signed and everything like that, but due to unforeseen circumstances, the surgeon was actually unable to attend the surgical procedure on the day. So he sent his colleague instead. Now, they worked in the same practice, so obviously the colleague had access to the patient's notes and things like that, but the patient had never met the second surgeon, and neither had the second surgeon met the patient. In the preoperative bay, the patient, obviously, she'd taken off work, she'd paid for the surgery, she's ready for the surgery, only to be met by someone new. She just went along with it. And she was actually quite happy with the outcome, but she did say that she thought the first surgeon would have done a better job, and that she had consented for the first surgeon to do the procedure, and perhaps some nuances of the abdominoplasty would have been different, like, for example, the shape of the umbilicus. And she then pursued litigation. So these cases are really interesting, and it just shows what can go wrong in all the steps of the informed consent process from start to finish. So this is an area where we can be kind and caring, and we can be ethical. And I think there is a lot more research that needs to go into the success of informed consent. And ideally, we need to have a more standardized process for all practitioners in the industry to get positive outcomes and to keep patient safety at the core of our practice at all times. So that's a list of my references, and thank you very much for listening.
That was great, Dr. Wetton. Really, really interesting. There was a couple of questions that I had from people who've been unable to attend today, but you actually answered them in the presentation. But I do have one, and that was, you did touch on it a little bit, and that was about telling people the risks and the things that can go wrong, and your body isn't that shape, so you're never going to look like that sort of stuff. But it was actually, the first one is in relation to breast surgery. So I myself didn't find out until only about 10 years ago that breast augmentation surgery is not permanent. You don't go in and get a pair of boobs slapped in and they're there till you die. They've actually got a shelf life, and they're only around for a maximum of 15 years, I understand, but potentially much less than that, where you may need to have them replaced. Is that something that you find people still don't know about, and that's a surprise for them when they're wanting to get that surgery done, that they're going to need to keep on having it done?
Absolutely. So a lot of patients who I get are revision breast augmentation patients, but the ones who come in for their primary breast augmentation, I really stress the fact to them that breast implants are not lifetime devices. You will need to have a surgery at some point in the future, possibly 2 or 3 surgeries. And although we don't give a shelf life as such, we say to them, every patient is individual, and how your body reacts to the implant and what ensues in the next year to 10 years, we can't predict. And this is also very important in rhinoplasty. Although rhinoplasty is a surgical procedure which I don't usually perform, the revision rate for rhinoplasty is very high, just generally. So it's important in these certain procedures to really drum that home to the patient. This is your first surgery. You may need a tweak down the line at some point, and same for implants. This is your first surgery. Guaranteed you will need to have more in the future.
Mm. And that follows on to the second query, which was actually about rhinoplasties. This person has said the pixie nose, the little turned up nose that was so popular a couple of years ago. And they talked about the revision rate for rhinoplasties being in the order of about 38%. I don't know, it might be higher, but that's what I've got in this email here. But they're saying, is it because people have in their mind a movie star, they want that movie star's nose, or is it some other reason? Why do they want their noses revised more than any other body part?
Sure. Well, there are a few reasons. One is the cartilage in the nose is very unpredictable. And so when you operate, you can place it in one place and stitch it there, and 6 months later it's moved. So that's one reason. Technically, the results are very unpredictable. Once the skin envelope over the cartilage settles and contracts, often things, again, look a bit different. The second reason is obviously patients have an idea in their head. And if it's not that exact image, then they want to keep going until they get that image, which may or may not never happen. And the third thing is often a certain surgeon may have a particular look that he performs in terms of rhinoplasty, but that may not be congruent with the patient's ideal. And then they go to seek a second surgery with a second surgeon, trying to get that shape that they desire.
Good, thank you. I've got a question here from Tamara, who says collaboration and consent processes for sedationist or anaesthetist are also an issue. Dr. Tamara is actually an anaesthetist.
Oh, great. Okay. Yes, I can imagine. Do you want to tell me a little bit about your experience as an anaesthetist with this? Is there something? Yeah.
Sure. Look, for many years I had plastic reconstructive and cosmetic surgeons as quite a large part of my practice, a bit less now. And there was definitely that issue, several issues you've raised in terms of the medical fitness, the appropriateness of the setting, for instance, day versus this person medically should be in an overnight stay. And also my perception of whether my consent process was felt to be relevant. I mean, a lot of these young ladies would unfortunately sort of look at their nails as I was talking and say, yeah, but I've heard it's very safe. And I found that frustrating. My strike rate with calling people on the phone in the week prior to the surgery would have been less than 50% because people don't pick up an unknown number. Then you'd get them, with sometimes very little information on the day, with a lot of time pressure because this is a commercial kind of thing. And I found that a bit frustrating. And I think it's not so much for regulation, but more an issue of, I mean, for instance, our anaesthetic college guidelines, which sort of give you pegged ideas of what your standard of consent should be. But I think that has to be collaborative when patients are a bit more complicated. For instance, that 72-year-old, I was once presented with an 84-year-old for a third facelift at a day procedure centre. So that ended a relationship with the surgeon because I wasn't going to proceed. And there's a commercial pressure there.
It's 100%. And that, unfortunately, that really is, I find, the stressful part, which is why I much prefer to take things slower and discuss these sort of cases with my anaesthetist prior to booking the case,
and I work with terrific people who are great collaborators, great communicators, and who I know spend a lot of office time and, a delayed appointment for review, have a think, and get psychological assessments when they seem indicated. And that's a terrific relationship in which to work. It just isn't always the case, but as you're talking about all this, that's what we're trying to improve, I guess, aren't we?
Absolutely. And I think, your discussion about trying to consent a patient while they're looking at their nails and all this, I find sometimes the best way to bring them down to earth is really to shock them. Like I say to my anaesthetist, they're not listening to you. Tell them they could die today. Like, you need to sort of shake them out of their bubble.
Right, act.
Not just getting my nails done sort of thing. That's the case sometimes in the surgical consent. They say, oh, well, it's just a facelift. I'll be fine to go to work the next day, won't I?
Look, yeah, I'm fond of the phrase, you're not here for a facial, which can then lead to a bit of a discussion, but it can be hard in that time pressured setting.
Yes.
To do, as you say, go a bit more slowly.
Yes, no, I agree. It is very stressful. And maybe, when things change a bit more a few years down the track, things won't be so sort of focused on financial gain. And we can really put our focus on the patient, because that is what is important in this industry. It's our patient,
Wonderful. Look, we're going to have to wind up now. No one else has any questions? Cool. If you do have any questions, of course, you can always convey them to me and I will pass them to Dr. Wetton for her to answer. That was actually a really great presentation, Dr. Wetton, really the gold standard of consent, not just in cosmetic procedures, but really across surgical procedures. But obviously with our focus today on the uniqueness of cosmetic procedures, the emotional reasons for them and all of that. So I think that's absolutely wonderful, and this one's going to get watched a lot. I thank you so much for your time today and for your effort in putting together this valuable information. Thank you everyone who attended. Go and have a great rest of the day.
Thank you so much.
Thank you. Stop the recording.